Welcome back to Diabeteslearnhealthy.com. Today we're going to talk about what is your diabetes. So as I go through the information, I want you to think about what best describes your diabetes. So let's get started. Let's take diabetes again out of the body and let's really break it down into parts, okay? So diabetes is about the pancreas. Diabetes is about the pancreas. The pancreas produces insulin, which is a hormone. Insulin helps move glucose into our cells. Utilizing the glucose as energy from the blood lowers the glucose in the vascular supply. So throughout the day we eat food, nutrition, and it breaks down into glucose. Glucose goes into the vascular system. The pancreas is aware of the elevated glucose level in the vascular system. It releases insulin into the blood. That hormone transports glucose from the blood and it takes it into our cells so our cells can function. Utilizing the glucose as energy from the blood lowers the glucose down to a normal range. So again, our normal range is above 80 and less than 180 post-meal. So let's talk about why that's important. Your red blood cells. So your red blood cells circulate in the vascular supply 90 to 120 days. And your heart is pumping those red blood cells throughout your body, and they are transporting oxygen and nutrients into your tissue and organs. So as long as those red blood cells are nice and soft and healthy, they can pick up oxygen and carry it into your tissues. So what happens is unused glucose remains in the vascular system, coating those red blood cells. So let's talk about target ranges. So target ranges would be a 5.6 or lower is pretty much your goal. A 6.5, you may be diagnosed with diabetes. And so there are different reference ranges. Sometimes you'll see someone says less than 6% or less than 7%. So you're looking at that weighted measurement. Also a 6.5, your primary care may say you're at risk. And so they may recommend some lifestyle choices or changes or put you on a therapy at that point in time. So we'll go through that. So again, our red blood cells live in the vascular system 90 to 120 days. And our goal is to keep the blood sugar between those two numbers to keep our red blood cells nice and healthy so they can transport oxygen into our tissues and organs. And so that A1c is a good indicator for your primary care team to look at your risk for microvascular and macrovascular complications and damages, which could be damage to your eyes, your kidneys, your organs, your heart, and really look at to make sure that your vascular system is healthy. So let's talk about the types of diabetes. So type 1 diabetes, you do not make insulin. So any age can be diagnosed with type 1. So type 2 has two parts to it. So do you produce insulin? Does that pancreas produce insulin? Again, why would your pancreas not make insulin? Well, we know some genetics, but we also know infections, injury, environmental triggers could affect that pancreas to where it does not make 100% insulin. And the other part of type 2 is called insulin resistant. And those are lifestyle changes and choices that you can actually improve that part of the type 2 diabetes and have better blood glucose targets. So what causes insulin resistant? Let's think about that. Insulin resistant means that your cells have a wall around them, a cytokine and inflammation. So when that insulin tries to transport glucose into that cell does not respond, and it requires a higher amount of insulin to get that cell to respond to allow it to take the glucose into that cell. So how do we thin that wall? So what causes that wall? Weight. So we know that weight causes that wall. We also know medications such as steroids, but the benefit of the steroid outweighs that insulin resistance. And you'll work with your primary care to ensure that your target ranges are good while you're on a steroid. But again, if you need to be on a steroid for breathing, for inflammation, then it's a beneficial medication. And again, you'll work with your primary care. Infection. So if you have an infection, you can very well have hyperglycemia. So that infection, sinus infection, tooth infection, urinary tract infection, those need to be resolved working with your healthcare team. And then inflammation, joint problems, pain, you'll be evaluated and maybe do physical therapy and have whatever needs to be resolved that's causing that inflammation is the best choice plan. And then we know that stress, so stress can produce a cortisol. It's that fight or flight hormone. But that's a good hormone, but we don't want to always live in that state. So it's important to have lifestyle skills to be able to bring that stress level down, whether it's walking, pray, meditate, but just be aware of that. Also, there's another kind of stress. Sometimes it gets combined with the distress, and that's called eustress. E-U-S-T-R-E-S-S. Eustress. I like that stress. That's a good stress. That's your motivating stress. So define the stress you're experiencing, because sometimes that motivating stress is saying, hey, you need to get off the sofa. You need to go take a walk. You have a project to work on. That is a good stress, and you want to have that kind of stress. Also, pregnancy. So pregnancy can cause insulin resistance. We would say gestational diabetes, and that pretty much will resolve once you deliver, and your primary care team will monitor you for persistent diabetes. And then the final one is 1.5 LADA diabetes, and that is a autoimmune of the adult diabetes. And so that pretty much means that your immunity, your T cells, destroy those beta cells, and so you do not make insulin. So normally what happens in that population is they will lose unintentional weight, they will be tired and fatigued, seek medical care, and find out that their blood glucose is maybe 700, 800, or 900, and their A1c would be 11, 12, 13, 14. So think about that. If the red blood cells are coated with a 12 or 13 glycemic coating, they cannot pick up oxygen and carry it into your muscles and your tissue to function properly. Absolutely, how fatiguing that would be. Those labs do tell us a lot about how you really feel. So as we go through the types of diabetes, think about the lifestyle changes and choices that you can change to have better target ranges. And also to think about the consistent carbohydrate meal plan. And if you are on insulin, you are also going to be on a consistent carbohydrate meal plan. So let's talk about the types of diabetes. Whether you're a type 1, type 2, or a 1.5, the type 1 and 1.5 are going to be on something called an insulin to carb ratio. They'll eat a certain amount of carbohydrates, and they will be taking a certain amount of insulin according to how many carbohydrates or what their insulin to carb ratio is. And so also you may be on a long-acting insulin, and that's that hovering insulin, so that when you eat or your cells need glucose, it's always in there. So it's really important to understand that you are on a consistent carbohydrate, and your therapy may be an insulin therapy, and what it's trying to do is mimic what the pancreas normally does. And so going through your medications, whether you're on insulin therapy or oral medications or some of the other newer one-time-a-week medications, it's still important to always think about all of those medications. Always say with diet and exercise, you will see some results. So it's important to understand how to plan your lifestyle changes so that you can really see some true results pretty quickly. So for more learning products, I'll see you back at diabeteslearnhealthy.com.